So other things that are positive in DDH is one is telescopy. Okay, telescopy means piston like in and out movement of the femur. Okay, so that is actually telescopy positive. Okay, and whenever we talk about the management, so management depends upon the age of the patient. So generalized, whenever we talk about management, Pavlik harness, frog leg cast. At the end stage, if nothing was, one is pelvic osteotomy, other one is femoral osteotomy, and at the end of the day, you'll just go for total hip replacement. Okay, so it depends upon the age. So majority of the DDH, when it comes at birth, what is the complaint of the patient? So complaint is whenever she tries to wear a diaper to a female child, okay, the hip tends to come out, and that's the complaint. So if it's age 0 to 6 months, you can just use a Pavlik harness splint. Okay, you can use a Pavlik harness splint, or you can use a von Rosen splint. Von Rosen was an X-ray modality, one is a splint. Okay, so Pavlik harness, what's the advantage? That you can easily use the diapers. Okay, and it prevents there is difficulty in internal rotation and abduction, right? So it keeps the hip in abduction and internal rotation and prevents external rotation and adduction. Okay, Pavlik harness, and that's a major advantage. Now if you talk about 6 to 18 months, so whenever we talk about 6 to 18 months, then you'll go for 6 to 18 months, either you go for closed reduction and use the frog leg cast, or you go for open reduction. Open reduction is usually performed if in case it's a case of more than 1.5 years, because in between the acetabulum and the head, there are transposition of different things. Okay, and the hip, in the hip, it looks that there are different skin creases. Okay, so that is why if the age is 6 to 18 years, you'll go for a open reduction, or you go for closed reduction, and then you will use a frog leg cast, or you can use a bachelor's cast. Okay, bachelor's cast. Next thing that what you can do is, next thing you can use, you can actually, if it's 18 to 36 months, you go for femoral osteotomy. If it's more than 3 years, you can go for pelvic osteotomy. The names of pelvic osteotomy is very important. One is Chiaris, one is Pemberton, one is Salter. If you want to remember what is it, study from book, but just remember the names. Next is more than 10 years, you can go for a total hip replacement. Okay, there are a lot of complications, like one is avascular necrosis, untreated faulty gait may be there, failed reduction may be there. Okay, so DDH is very important. Study it well. Study from Maheshwari. So I have taken everything from Maheshwari. Okay, thank you.